All right, so let me tell you a little bit about Aubagio or teriflunomide. So the history of this drug is that it came from a rheumatoid arthritis drug and a drug that is also used for psoriatic arthritis. The drug there was leflunomide. When we take that medicine, the body converts it over into teriflunomide, which is what Aubagio is. So we actually have had experience with this medicine since the 1998 when it was approved for rheumatoid arthritis. For MS, however, this was only our second oral medicine. It only got approved in 2012. It is the only medicine so far that, beyond sort of reducing relapse rates, and two of the main studies that led to the approval of this medicine, that it had a big effect on sustained disability and also had some effects on MRI measures. The way that this drug works is that when cells are dividing, the cells need to have and make DNA and RNA components so that they can basically have twice as much DNA and RNA components to do that. And we can make those through two different pathways. One is called the salvage pathway, and that's left intact by this medicine. But the other pathway is called the de novo pyrimidine synthesis pathway, and that involves an enzyme called DHODH, which is what this drug inhibits. So when cells are very active, such as when you have a very active inflammatory pathway, this medicine will sort of inhibit this extra pathway, and it prevents cells from getting very active in this inflammatory pathway. There were two main studies that led to the approval of this medicine, TEMSO and TOWER. They were both fairly similar in sort of the patients that were recruited into the study, and they both had a reduction of relapses of around 32 and 36%, so very similar. They also reduced the 12-week disability progression, which again was sort of the unique thing about this medicine, and that was around 30% for both studies. And one of these studies, the TEMSO study, also had MRI measures and had about a reduction of about 80% on new contrast-enhancing lesions. There was also a study called the TOPIC study that looked at patients who were presenting with their first episode or this clinically isolated syndrome, and before we could call them MS, to see if it could prevent the chances of going on to MS, and this drug was able to do that. The biggest thing with this medicine is tolerability. So nausea and diarrhea are big factors, and much like in any study, placebo can cause all these symptoms as well. And so these numbers may seem kind of high. For nausea, it was 12.3%, but in the placebo arm, that was 7.8%. And for the diarrhea, that was at 14.4% versus in placebo, which was 7.9%. There's also concerns, particularly with hair thinning. That was about 15%. And concerns for raising enzymes, liver enzymes. And that was usually very minor things. But because of that, we do need to do some testing of that. And because of the liver things, we check labs every month for the first 6 months. There was also concern that it could reactivate tuberculosis or TB. And so we need to test patients before they can start the medicine to make sure that they don't have TB. And it's also pregnancy category X. These categories are kind of going away in the near future. But as the name kind of implies, there's some concerns that these medicines may not necessarily be the best medicines for young women who might be thinking about having kids. So far, this hasn't been a lot of signal regarding that, but the concern has been for the parent drug, leflunomide, and so a lot of this testing has come from that other medicine. The nice thing about this medicine is that you can wash it out. You can take something called cholestyramine, so if you do run into these issues, you can kind of wash out of this medicine and kind of get rid of it out of your system fairly fast. The way I tend to think about Aubagio, just to kind of my take-home points from it, is that it's an effective drug. We don't understand where it fits with all the other medicines as to how potent the drug is. It's probably at least in line with the injectables. It tends to be fairly well tolerated, but it does require some monitoring.